We've been following the story of Wichita teen Zay Uwadio since January. Her medical battle garnered national media coverage and caught the eye of doctors from as far away as Harvard University. Cake News on Your Side investigates. Taylor Adams is here with this exclusive story.
Doctors tell us a newly published medical study could help prove that a common antibiotic led to Zay's death. While they still have much more work to do, they tell us patients nationwide have come forward with striking similarities. One drug, a common denominator.
It's been very painful. I don't want to die.
They're words no child should utter, and no parent wants to hear.
But my God, she had so much potential too. Like, she just had this brilliant mind.
Bree Kirshen's daughter, Zay Uwadio, was a bright and healthy teenage girl until the day she went to the doctor for a urinary tract infection.
She was experiencing such severe pain going into the office, she almost fell down in the parking lot.
The antibiotic doctors prescribed worked, but new problems emerged, and her mom, a nurse herself, knew her daughter was in trouble. Zay was uneasy. She couldn't get out of bed, and she couldn't breathe, so her mom brought her here to this Wichita emergency room.
They said, we can't find a reason for what's happening. We spoke with the pulmonologist at Children's Mercy, and we need to get you there. We're flying now. So we left, and we flew.
Dr. Jenna Miller, a pediatric physician, was waiting for Zay when she landed at Children's Mercy in Kansas City.
At the beginning, we did a very extensive infectious workup to try to figure out if there was something we could identify and then treat. And we never found anything.
Days, weeks, and even months passed. Zay's life support so extensive, national media picked up her story, catching the eye of Dr. Martin Taylor of Harvard University.
My wife saw the story of Zay on the news and said, doesn't this sound a lot like your patients? My patients had both been exposed to the drug Bactrim.
Doctors originally prescribed Zay Bactrim, and while her pharmacy gave her a generic version manufactured by Vista Pharmaceuticals, doctors say the generic is interchangeable with the brand name. Harvard doctors had been studying the effects of Bactrim and its generic equivalents in patients who'd become sick. They noticed a disturbing similarity. The lining of their lungs was gone.
This was a pattern that was very striking because normally, something that was supposed to be there was just not there.
Doctors from Children's Mercy published a study in the Journal of the American Academy of Pediatrics. They studied 5 previously healthy young patients. Of the 5 patients in the study, 2 died. 4 were considered for organ transplants, and all experienced lung failure.
I think without Zay and Bree, there is no possibility in my mind that we would have found all these cases and put them together.
The CEO of Vista Pharmaceuticals, Dr. Jay Ali, told us that his company is one of many drug companies that make generic Bactrim, and that this is one of many reactions that can occur.
It's unfortunate to hear the little girl's disease. This is one of those severe adverse reactions that they're talking about for any drug molecule.
Little consolation to a child on life support.
To keep myself going, I just tell myself nothing lasts forever. And I'm gonna get home eventually.
And Zay did. After 457 days in the hospital, she returned home to Wichita to a crowd of friends and family. She died just 12 days later. Zay had just turned 17.
And Zay was still in my arms, and I just was kissing her forehead and talking to her and telling her I was sorry and I loved her and it was okay. And even in all of her suffering, we were very lucky in so many ways.
Contact the manufacturer of the name brand Bactrim. The company declined to comment. In the meantime, doctors hope to develop a test to determine if you could have a similar reaction to the drug before prescribing Bactrim.
Oh, this is just heartbreaking to see that. And I know Bactrim's prescribed a lot. So what should we as patients know?
Well, first of all, if you are prescribed Bactrim, you should always have an accurate, up-to-date result of your medical history. You should bring that to your doctor's appointments. And second, if anyone in your family is allergic to Bactrim or any other sulfa drug, don't be afraid to ask questions and even request a different antibiotic. Most importantly, if you ever feel ill or if you develop any new symptoms while taking the medication,
stop immediately and contact your doctor.
All right, Taylor Adams for us tonight. I know a lot of digging went into the story. Well put together.
The FDA has now put a popular antibiotic on a watch list.
The news comes after doctors discovered the death of a Wichita teen might be linked to the antibiotic Bactrim. Cake's Taylor Adams is here with more tonight. Taylor.
Just days ago, Bactrim and all of its generic equivalents were added to the FDA's watch list. Respiratory failure is also now included as a potential side effect. A huge development for Zay's doctors because until now, the FDA did not acknowledge this reaction as possible.
Bree Kirshen's daughter, Zay, is now gone. Even so, she's still fighting.
Zay would be proud. I think she would be fighting maybe in a different way than I do. She's so strong.
For months, doctors were stunned by Wichita teen Zay Awadia's mystery lung illness. Zay died early this year after a long stay in a Kansas City hospital. After her story reached national news, other patients with the same symptoms contacted her doctors. Finally, they connected the dots. Zay and the other patients had all been prescribed Bactrim, or its generic equivalent.
The numbers continue to increase for people who are interested in learning about whether their reaction had anything to do with this drug.
Dr. Jenna Miller with Children's Mercy in Kansas City published this study in the Journal of the American Academy of Pediatrics. Researchers looked at 5 previously healthy young patients who had taken Bactrim, or generic Bactrim. Of the 5 patients in the study, 2 died and all experienced lung failure. Now, another breakthrough. The Food and Drug Administration is recognizing the research.
The drug has been around since the 70s, and we suspect there are several more injuries.
Before now, acute respiratory failure was never listed as a possible reaction. But in a recent report, the FDA officially added Bactrim and its generic equivalents to its watch list.
By the FDA acknowledging that Bactrim causes acute respiratory failure in some patients is a big leap.
I want it to be on the same level where when providers think that they're prescribing this drug, they need to think about, okay, this bad skin reaction can happen and this bad lung reaction can happen.
Dr. Miller says the fight is far from over because educating doctors on what this reaction looks like could be a long road. In the meantime, she's still working to create a genetic test that could quickly determine if a patient will have a reaction like Zay's. We will continue to update you as more information comes in. In studio, Taylor Adams, Cake News on your side.
A Cake News on your side investigation follow-up tonight. For months, we've been covering the story of a Wichita teen who died earlier this year after taking a commonly prescribed antibiotic.
Now the FDA has recognized research connecting that drug to lung failure, and more families are coming forward with their own stories. Cake's Taylor Adams with an emotional meeting between 2 families who are grieving the same fate.
An embrace these 2 moms have been waiting for.
Every time I come back here.
Before this day, Bree Kirshen and Amy Caldwell had never met, but they have more in common than you would believe.
So we entered the hospital when she was 15, and we left right before her 17th birthday.
I had her in ER, urgent care, or her primary care doctor, I think 6 times.
Both nurses and mothers of 2 young girls. Zay Awadia and Abigail Caldwell's suffering both started with a routine infection and a prescription for a common antibiotic.
So Abigail was on day 18 of Bactrim, and she woke up and she had a low-grade fever. And
each day was just worse off than the next. I mean, it was, here's her ventilator on Mother's Day, and then a few days later it was, you know, we can't do anything more for her in Springfield.
Her father, BJ, remembers feeling helpless as Abigail was flown to St. Louis Children's Hospital. Abigail's lungs were failing, and doctors stunned.
Everyone was so desperate to find out what was wrong with her.
Call it nurse's instinct or a mother's intuition, but from day one, Amy had a suspicion.
I talked to the nurse and I said, could this be a latent reaction to Bactrim? And I remember she kind of laughed at me a little bit and said, aren't you a nurse?
But time wasn't on Abigail's side. Even with a ventilator, she couldn't breathe on her own. So her doctors placed her on ECMO, a form of life support that bypasses both the heart and the lungs.
She did mouth, am I going to die? Never spoke again.
Don't remember the last word she said to me. didn't think to log those things.
Abigail died in May of 2018, just 37 days after her first dose of the antibiotic, leaving the Caldwells with no answers on why their little girl was gone.
Just to not know why is another layer of just agony.
It was 8 months later when Amy saw this article on CNN about Zay. Like Abigail, Zay was on ECMO, but it was Zay's ability to walk on the treatment that gained her national attention and gave the Caldwells some answers.
And then we kept reading, and then that last piece said that there might be Bactrim. I knew it. I knew my kid died from Bactrim. I knew she did.
Abigail and Zay are now two of a growing list of people involved in a study involving Bactrim, or its generic equivalents.
I am certain that there are more cases than this.
Dr. Jenna Miller, one of Zay's doctors at Children's Mercy in Kansas City, says without Zay, Abigail, and the girl's parents, none of this research would be possible.
Historically, a lot of these patients did just die, and we just never knew what happened to them.
A breakthrough in the medical community.
Our babies are dead. But then to have someone that died the same, that's something there.
But a hole left in the hearts of so many.
There are parents out there whose kid died and are destroyed and have no idea why.
Whether it's 20 patients or 20,000 or 20 million, there's a responsibility to tell people.
Taylor Adams reporting. In a previous story, we contacted the manufacturer of the antibiotic that Zay Uwadia took. The response was this: "It's unfortunate to hear of the little girl's death. This is one of the severe adverse reactions that they are talking about for any drug molecule."
Experts say Bactrim and all of its generic equivalents do have an important place in the medical community, but say it's okay to question your doctor or even refuse the medicine if you or your family members are allergic.
In the meantime, researchers are developing a test that could determine if a patient will have a reaction before he or she takes the drug.
And of course, we'll continue to follow this.